Marky, thank you. I'd like to bring in Michelle Fuentes. Michelle is one of the nurses at that Houston Methodist Hospital, and she joined the lawsuit as well after losing her job for not getting the COVID vaccine. Michelle, appreciate your time tonight. Let's begin with your job. Were you prepared to lose your job over this?
I actually got let go before the suspension dates because I wouldn't stop talking about my views on the COVID vaccine and the reactions that I saw happening. And so I was brought into my manager's office to discuss ways that I could get around keeping my job and not getting the vaccine. I was asked to sign a religious waiver. I refused to sign the religious waiver. So they asked me, did I think that I could go back into the work area and not discuss my views on the vaccine? And which I said that I didn't feel like my voice should be silenced. And at that point, my things were gathered and I was escorted out.
So you were fired for sharing your opinion about the vaccine, not for not getting it?
Yes.
Okay. Are you getting the vaccine?
I'm not. No, ma'am.
So what are your concerns about it? You're working in a healthcare environment where people come in sick, they expect to be taken care of, and the global health perspective here, I just interviewed a doctor who said, in order to stop this virus, we need to be vaccinated. So what were your hesitations?
I know personally, I have had the COVID virus, and so my antibodies are still up. And actually, it's not recommended for me to get the COVID vaccine for 6 months at least. And I could prove that I had a titer. So it wasn't about protecting my patients as much as meeting an agenda. I could show that I was still a safe and effective nurse, and I didn't pose any threat, nor did I when I worked the COVID unit and donned PPE and provided, infection control measures. I was a safe nurse then. I feel like I could still be a safe nurse now and not put my community nor my patients in any type of jeopardy or harm.
But isn't the vaccine another line of defense that further protects not just you, even if you've had the virus, but your patients who may be susceptible, who have depleted immune systems, who are in the hospital to be treated?
I think that everybody has to weigh the risk and the benefits. Much of medication and medical science is weighing the risks of a treatment and the benefits of a treatment. Why should I take a risk of having a side effect like a heart attack or a stroke or an anaphylactic reaction, in which I've seen my cousin, who's a 25-year-old that's struggling after getting the vaccine, and still they're unable to stop her from having an anaphylactic reaction. She's been intubated and extubated 7 times. And the only thing that she's done as a young female with no prior health conditions whatsoever is get the vaccine just prior to this reaction occurring.
I am sorry for your cousin. However, you work in a medical environment, and I haven't yet spoken to a doctor who said that any of the risks are prevalent across the major portion of the population. These risks are very rare if you get the vaccine.
Well, that's because I believe, and I know firsthand, because even my cousin's reaction, everybody's skeptical and scared to report because it's going against society's norm or what the agenda they're trying to push. So a lot of these reactions that are actually occurring aren't actually being reported. Because if you have a heart attack after having the vaccine, they'll say, oh, well, you just had a heart attack. It's not vaccine related, even though you're a 30-year-old female or male with no prior health condition.
Michelle, I'm going to stop you there. The data and the science from the CDC and all of the top medical facilities across the country would disagree with what you're saying there. But I do want to talk about this lawsuit. You're part of the lawsuit in Houston. What is your hope and expectation for this lawsuit against the hospital?
I'm fighting for our global human rights to remain intact. We should not be forced to participate in a clinical trial. There's still more studies that need to be done, and I don't feel that it's safe at this point.
Michelle Fuentes, we appreciate your time tonight on News Nation, a nurse at the hospital in Houston, part of this lawsuit against the hospital and does not want to get the COVID vaccine. I appreciate you talking to us.
Thank you very much.
Thank you.